Altered Physiology, Mechanisms of Disease 2, Week 1, Episode 4, a continuation of our lecture series on the MSK system. In this particular episode, we are moving on from osteoarthritis, which we talked about as being a common age-related disorder of the synovial joints, where you have a loss of articular cartilage, versus now we're looking at rheumatoid arthritis being more of an inflammatory autoimmune joint disease with the destruction of the connective tissue, primarily at the joints with your synovial membrane, but it can affect other areas throughout the body where we have connective tissue. And for that reason, it is considered to be a systemic disease because it can affect other organ systems such as the heart, lungs, kidneys, and skin, in addition to the joints. None of this is new information. We did kind of characterize it in the last episode, but nonetheless, here is a good summary slide for you. Some of the symptoms are similar to osteoarthritis in terms of things like pain, but the cause really is still unknown for rheumatoid arthritis. It tends to be multifactorial. As I mentioned in the preceding episode, one distinction between osteoarthritis and rheumatoid arthritis is, in fact, that we know that RA tends to have a strong genetic predisposition. Now, if we look at some of our understanding in the pathogenesis of rheumatoid arthritis, it is understood that neutrophils, which are white blood cells, and other cells in the synovial fluid will become activated, as will inflammatory cytokines. And so a number of the cytokines are listed here. Your interleukins, 1 beta, 6, 7, and 21, all induce the enzymatic breakdown of cartilage and bone, as does TNF alpha, or tumor necrosis factor alpha. The T cells, which are another type of your white blood cells, also interact with the synovial fibroblasts through TNF alpha, and that is what can lead to a very abnormal thick layer of granulation within the tissue, also known as pannus. Now, the next slide highlights an interesting schematic diagram showing you just how complicated, really, the pathogenesis of rheumatoid arthritis is. In the preceding lecture slide, we highlighted the role of many of your white blood cells. So you have your T cells and your B cells, you can see there within the lymph nodes. Those, once again, are two types of white blood cells that we typically see in adaptive immunity. It does have an effect on the immune system. So once again, rheumatoid arthritis is an autoimmune condition. Autoimmune conditions are essentially like a fancy word for saying that the body's own immune system is attacking the body, right? So it can produce an inflammatory type state, which you can see highlighted on the top right hand side of the diagram. And the you do have a release of a number of different factors. In the preceding slide, I had also alluded to the activation of your inflammatory cytokines. You can see a number of those cytokines highlighted on the bottom right of the diagram. The activation of the neutrophils also in that cyclical pattern highlighted on the bottom right. You also see the role of your osteoclasts, and we know that osteoclasts can be associated with tissue remodeling, particularly the breakdown of bone. And from your preceding episodes, you'll know that rank L, for example, would be one such factor that can contribute to the activation of your osteoclasts and the breakdown of bony tissue. For this particular diagram, once again, it is a schematic diagram of what we've talked about on the preceding slide. So what you see on the preceding slide really is the extent of which you are required to know. So don't worry necessarily about the intricate detail that you see here. This, once again, is supposed to be a really good visual, just showing you all of the connections and all of the different types of cells that may be involved in rheumatoid arthritis. The next slide is also a schematic diagram highlighting just once again how many different factors are involved in rheumatoid arthritis. So once again, there are so many different cells and their cytokines. Once again, cytokines being your interleukins and your TNF alpha that play a critical role in RA development. The synovial compartment is infiltrated by your white blood cells. So we've highlighted some of those already in the preceding slides. And the synovial fluid is also inundated with inflammatory type mediators that induce an inflammatory cascade. Once again, this really is not new information. We've been talking about how it is an inflammatory autoimmune type condition that does involve the white blood cells and your inflammatory cytokines. There are so many different cells, though, of the innate immune system, like your monocytes, macrophages, mast cells, dendritic cells, and so on, that contribute in addition to, I mentioned the T cells and the B cells of the adaptive immune system. Collectively, once again, this can lead to the development of disease. Whereby osteoblasts and your chondrocytes, which are the cells of the cartilage, decrease while the osteoclasts will increase. And once again, osteoclasts are responsible for the destruction of bony tissue, including the subchondral bone, and that can eventually result in the degeneration of the articular cartilage as a result of a decrease in the osteoblasts and an increase in those osteoclasts. And so that's really what we're looking at on this particular schematic diagram. Now, here are some defining features of rheumatoid arthritis. So it has an insidious onset. So once again, it's not age related. It really can occur at any point in one's life. And once again, we don't exactly always know the underlying causes. You will see that some of the clinical manifestations are similar to osteoarthritis, but individuals can also have things like fever and weakness. It may also be associated with weight loss and anorexia. Individuals can have one also similar to osteoarthritis, pain, tender, stiff joints, and joint deformities. In rheumatoid arthritis, there is something known as the Kaplan's syndrome, and in these are nodes, and it's somewhat similar to what you would have seen in osteoarthritis with the Bouchard nodes um, or the Heberden's nodes as well. So once again, that characteristic joint deformity. Okay, so a couple more schematic diagrams to show you. Once again, this particular diagram I'm showing really just to highlight the fact that you have a number of those inflammatory cytokines present in rheumatoid arthritis that are not present in osteoarthritis. And once again, that being that it's an inflammatory autoimmune condition. I show this diagram specifically, though, so that you can see just how many different tissues it can affect. And so we talked about how, we do have various types of connective tissue in the body, and that in rheumatoid arthritis, those tissues can be affected. And therefore, once again, it's a systemic disease. Looking at our That was looking at our final slide, and so that concludes this episode on rheumatoid arthritis.